Welcome to Narcissist, kung saan pag-uusapan natin ang ating mga sarili dahil tayo ay intended para malaman natin ang anatomy and physiology ng ating katawan. Our discussion for today ay tungkol sa adrenal gland. Hala! May suprarenal gland ka! Joke lang po, hindi po yung sakit. Ang suprarenal gland is also known as adrenal gland, are small triangular shaped glands located on top of both our kidneys, sa left and sa right hypochondria. Adrenal glands produce hormones that help regulate your metabolism, immune system, blood pressure, response to stress, and other essential functions. Ang adrenal glands ay mayroong two parts, ang adrenal medulla at adrenal cortex, which are responsible for producing different hormones. Alam kong mas gusto niyo pa ng further information tungkol sa ating adrenal medulla at adrenal cortex. Kaya makinig na tayo sa mga susunod na magsasalita.
The adrenal medulla, the inner part of an adrenal gland, controls hormones that initiate the fight or flight response. The adrenal medulla is located in the innermost layer of the adrenal gland and is dark brown in color. It contains homogeneous sheets of organized cells into nests that have large, varied nuclei and abundant cytoplasm packed with numerous secretory granules.
The epinephrine and the norepinephrine are hormones that are secreted by the adrenal medulla. They are also called the fight or flight hormones. The epinephrine consists of 80% of the adrenal medulla secretions, while the norepinephrine only consists 20%. The major effects of the hormones released from the medulla are 1. Release of stored energy sources to support increased physical activity. 2. Increase of blood pressure. Two effects of the epinephrine that causes elevated blood pressure are increase of heart rate and constriction of blood vessels in skin and internal organs. 3. Increased blood flow to skeletal muscle. 4. Increased metabolic rate of several tissues, especially skeletal muscle, cardiac muscle, and nervous tissue. Responses to hormones from the adrenal medulla reinforce the effect of the sympathetic division of the autonomic nervous system, function together to prepare the body for physical activity, fight or flight, response to stress. The adrenal gland, also known as suprarenal gland, is located superior to each of our kidney. It is surrounded by a connective tissue capsule and has an inner part called the adrenal medulla and an outer part called the adrenal cortex. The function of the adrenal gland is to produce hormones that regulate important body functions like metabolism, immune system, blood pressure, response to stress, and sex hormones.
The adrenal medulla is the inner portion of the adrenal gland. It is composed of irregularly shaped cells grouped around the blood vessels. These cells are intimately connected with the sympathetic division of the autonomic nervous system, or also known as ANS.
As for the regulation of adrenal medullary secretions, it starts with the stimulation of the hypothalamus by stress. Physical activity or low blood glucose levels causes action potentials to travel through the sympathetic nervous system to the adrenal medulla. In response, the adrenal medulla releases epinephrine and smaller amounts of norepinephrine into the blood. And lastly, these hormones have several effects that prepare the body for physical activities.
Its hormone is adrenaline and noradrenaline. The target tissues are heart, blood vessels, liver, and fat cells. Its response is increased cardiac output. It increases blood flow to skeletal muscles and heart. It increased release of glucose and fatty acids into blood. In general, hinahanda yung katawan natin para sa physical activities.
Hala! Si ate! Stress na! Baka makolesterol ka na! Joke lang po.
Stress dahil sa retorika, gaining weight, belly fat. Ang stress ay nagpapataas ng cortisols. Cortisols increases belly fat. Kaya, kailangan mo ng Relicor.
Ano pang hinihintay mo? Pasko? Matagal pa yun. Kaya tara na, bili na.
Pag kailangan ng gamot, huwag mahihiyang magtanong.
Kung may right med ba nito? May right med ba nito? Pag may kailangang gamot, huwag mahiyang magtanong. Kung may right med ba nito?
Munting paalala, ang pag-relapse ay hindi gamot at hindi dapat gamiting gamot sa anumang uri ng sakit.
Ang susunod na programa ay Rated G. Ito ay pwede sa lahat ng manonood.
The adrenal cortex is the outer part of your adrenal gland. It produces hormones that support vital organ functions and bodily processes. Many conditions can affect the adrenal cortex. Some cause the overproduction of hormones, while others limit hormone production. The adrenal cortex is located in between the capsule, which is the connective tissue of the adrenal gland, and the adrenal medulla. It is yellow in color and is divided into 3 zones within the adrenal cortex. And those zones are called the zona glomerulosa, zona fasciculata, and zona reticularis.
The adrenal cortex is responsible for producing hormones that support vital organ functions and bodily processes. It is affected by various conditions, including overproduction or limit of hormone production. Maintaining good health can optimize adrenal cortex function and reduce the risk of tumors and disorders. We have the zona glomerulosa. This produces aldosterone, which affects the body by causing water retention, increasing sodium levels, and removing the excess potassium through the urine output. Then we also have zona fasciculata. This produces cortisol, which controls blood sugar levels, supports metabolism, regulates blood pressures, and regulates sleep-wake cycle. Lastly, the zona reticularis. This produces androgens, including DHEA, which supports bone density, puberty, red blood cell production, and sexual function. In males, androgens are responsible for vocal cord lengthening, facial and chest hair growth, and sperm development, while in females, they regulate menstruation, play a role in conception and pregnancy, and they minimize bone loss.
The adrenal cortex is the outer layer of the adrenal gland. The adrenal cortex produces hormones that support vital organ functioning. Each adrenal cortex layer produces different hormones.
The adrenal cortex is the outer layer of the adrenal glands. You can think of it as a basketball court from the word cortex, and think of it this way. Usually, the basketball courts are outside, so it is the outer part. It is the adrenal cortex. It is divided into 3 distinct zones, each responsible for producing specific hormones. Number 1 is the zona glomerulosa. This outermost layer produces mineralocorticoids, primarily aldosterone. Number 2 is the zona fasciculata. The middle layer synthesizes glucocorticoids, mainly cortisol. Number 3 is the zona reticularis. The innermost layer produces androgens. These hormones are precursors to sex hormones like testosterone and estrogen. Each of these zones has a specific function and produces different hormones that play crucial roles in various physiological processes in the body.
The adrenal medulla and the adrenal cortex work together to regulate a variety of bodily functions. For example, during the stress response, the adrenal medulla releases epinephrine and norepinephrine, which increase heart rate and blood pressure. This helps to prepare the body for physical activity. At the same time, the adrenal cortex releases cortisol, which increases blood sugar levels and provide energy for the body to use. The adrenal medulla and adrenal cortex also play a role in regulating metabolism, blood pressure, and immune system. For example, cortisol helps to regulate metabolism and blood sugar levels. Aldosterone helps to maintain blood pressure, and androgens help to maintain muscle mass and bone density.
For regulation of cortisol secretion from the adrenal cortex, cortisol secretion is stimulated by the anterior pituitary hormone. It starts with how corticotropin-releasing hormone, or the CRH, is released from hypothalamic neurons in response to stress or low blood glucose and passes by way of the hypothalamo-physeal portal system to the anterior pituitary. Next, in the anterior pituitary, CRH binds to and stimulates cells that secrete adrenocorticotropic hormone, or the ACTH. Next, the middle layer of the adrenal cortex is very sensitive to ACTH. Once ACTH binds to its membrane-bound receptors, the adrenal cortex increases cortisol secretion. Next, cortisol acts on target tissues, resulting in increased breakdown of lipids and proteins, higher glucose levels, and increased anti-inflammatory effects. And lastly, both ACTH and cortisol act via negative feedback to inhibit CRH secretion from the hypothalamus.
Primarily kidneys, intestine, sweat glands, and most tissues. It responds to increased rate of sodium transport into body, increased rate of potassium excretion, and secondarily favor water retention.
Let's have a quick background on these diseases. Addison's and Cushing's disease. Involved na gland is our adrenal gland. So ano nga ulit ang ating adrenal gland? For example, ito ang ating kidney. On top of each kidney, nandyan si adrenal gland. Ang clue mo dyan is renal, meaning nasa kidney. Sa adrenal gland, yung outer surface niyan is called your adrenal cortex. And yung nasa loob is adrenal medulla. So ang concern natin is adrenal cortex. Dahil it is your outer part, dyan nangyayari ang synthesis ng mga involved na hormones na cortisol, aldosterone, and the sex hormones. Now, let's talk about the assessment or the manifestations. When we say Addison's, remember the word add. Ibig sabihin, kailangan mong magdagdag. Addison is the hyposecretion, so unti ang manyong adrenal hormones, and kapag naman Cushing's disease, increase siya. So remember, Cushing equals cushion, masyadong madami ang hormone. Let's start with Addison's. So again, konti ang inyong adrenal hormones. First, meron siyang lethargy. Hindi letter G ha. Fatigue and muscle weakness. Sa atin naman Cushing's, meron siyang generalized muscle wasting and weakness. So same silang may weakness. Si Addison's, meron siyang GI or digestive disturbance. Si Cushing naman, meron siyang moon face, buffalo hump, truncal obesity, pero thin ang kanyang extremities, and may weight gain. Pero kay Addison's, weight loss. Okay na, na-discuss natin kanina kung functions ng cortisol about sa glucose and protein metabolism, and also sa ating aldosterone, kung ano ang ginagawa niya sa ating sodium. Anong mangyayari sa ating glucose at sa sodium kung kulang ka ng iyong cortisol at aldosterone? Magde-decrease ang iyong glucose at magde-decrease din ang iyong sodium. Kasi wala kang aldosterone. Hindi makakarating ang sodium sa kidney. In comparison sa Cushing's, ay madami ang production. So, increase siya. So, mayroong hyperglycemia at hyponatremia. Pero pagdating sa ating potassium, dahil ang function ng ating aldosterone ay potassium excretion, so kung madami kang aldosterone sa Cushing's, anong mangyayari sa iyong potassium? So, increase ang excretion, so mababang potassium level mo sa blood. So, meron kang hypokalemia. Calcium is affected due to the removal of the calcium by the kidneys. So, pagdating mo sa Addison's, kulang ka naman sa hormones. So, hindi naman may excrete ang iyong potassium. So, you have hyperkalemia. And hypercalcemia, ang effect sa BP o blood pressure. Diba? May effect sa ating blood pressure. So, wala kang masyadong hormones. Hypotension, ang effect kung madami naman. Hypertension, ang effect, diba affected ang ating sex hormones at androgen. So, pwedeng may menstrual changes and impotence. Sa Cushing's naman, masyadong madami, so may hirsutism, meaning mabuhok sa katawan. And masculine characteristics. Sa skin, kay Addison's, may hyperpigmentation. At sa Cushing's, fragile ang kanilang skin that bruise easily. At meron silang reddish to purple na mga stretch marks sa abdomen at sa thighs. 2 points for recitation if you can guess this straight diagnosis. We have a 35-year-old female who presents with weight gain, central obesity, and muscle weakness. She also reports she's been feeling very tired and fatigued, with decreased energy levels and increased thirst. She also noticed excessive facial hair growth. Her skin becomes paper thin and fragile, and she has developed stretch marks on her abdomen and thighs. Now, based on the patient's history, what diagnosis would you expect?